Well, this is Bob Browner. I've started to resume recording community health updates again because I've been getting a lot of questions about measles lately, and whether measles is a problem that whether you should worry about it or not. And it kind of depends on your situation. So, if you haven't seen, of course, we've have been having a measles outbreak starting in Texas, which is over 1,000 cases already, and spreading to other states. And so the question is it going to come to Nebraska? And I think it's most likely going to get here. It's a question of how long. A few years ago, I wouldn't have been too worried about it because Nebraska used to be one of the best vaccinated states in the country. Unfortunately, that is no longer the case. So 5 years ago, we were over 95% of the state for measles vaccination. We've been dropping for several years, as have many other areas of the country, including Texas, which is why we're in the situation we're in right now. Here locally, the Lancaster County vaccination rates, especially for kindergartens, has dropped substantially in the last couple of years, where it used to be 94 to 96%. We've been gradually dropping for 3 years in a row and down before 89% last fall. This is probably not this low at this point right now. I do know that from our school nursing, where we track vaccinations in Lincoln Public Schools, that all of the Lincoln Public Schools buildings are above 95% now. So some of those kids have since been vaccinated. So there's a good chance we're making some progress here in Lincoln. However, across the state, this is, like I say, this is a snapshot in time. Some of the numbers have caught up as people have gotten vaccinated, especially their kindergartners and elementary schools. But you'll see a lot of pockets across the state. Basically, anything that's not green is not above that 95% protection threshold. And so we have many pockets across Nebraska where this has been happening, and should be concerning to the state. 5 years ago, that was not as much of an issue. Had very high vaccination rates, very few places below 95, and even when they were, it was more 93, 94. And again, this is just for kindergartners, and some of those kids did get vaccinated later that year, so this probably understates it a little bit. But it's that change that is the problem that we're having right now. So the concern among the public health community is that measles could become endemic again. And what that means is that cases would continue to spread within the United States rather than the occasional sporadic cases we've had the last 25 years, where mostly it was someone who had been traveling overseas, came back, maybe exposed a couple other people, and you had an outbreak of 3 or 4 or 5. But now we're having this outbreak where we're over 1,000 already just from that Texas outbreak. And so back in the last couple of years, you'd see a few blips here and then, but those were almost all imported cases where someone traveled to a measles endemic area, got infected, came back and exposed a few people who might not have been fully vaccinated. Now you've got this potential sustained transmission that'll continue. And so it's spreading across the country, and so Texas was the epicenter in Gaines County and outward, and I'll show a map later of Texas itself. It spread to Oklahoma, New Mexico, Kansas, and Kansas is over 50 cases now, and so just on our border, there's the chance that this could be spreading to Nebraska fairly soon. Now, maybe we've got enough of a vaccine wall on that southern border of counties where most of them are 94, 95%, but we do have our pockets, so there is the potential for sustained transmission once it gets here in the coming months, if it happens. So if measles become endemic again, why are we worried? Because that's going to cause a lot of disease deaths and cost a lot of money, actually, which I think is often being missed right now in the United States. So there's some modeling studies. So this article came out in the Journal of the American Medical Association last month, where they modeled the reemergence of what we thought were previously eliminated infectious diseases in the United States. They looked at scenarios for measles, polio, diphtheria, and pertussis, and modeled what would happen based on current vaccination rates or continued drop in the vaccination rates. And what they did is they started with all 4 of those diseases: measles, rubella, polio, diphtheria. And I'll point out one thing at the top. For the basic reproduction number, that's how infectious. And the problem with measles, it's one of the most infectious diseases, 4 to 6 times more infectious than, say, rubella, polio, or diphtheria. It spreads really easily. I'll note that this is actually a conservative number. The basic reproduction number estimates for measles are between 12 and 18. And how that affects herd immunity is if it was only 12, herd immunity is about 92%, where if it's 18, herd immunity is 94, 95%. So they're actually using some fairly conservative numbers for this modeling. But despite that, most models, when they run at the current levels, show that measles would become endemic at some point in the next 20 years. What they did is they ran a lot of simulations, and so part of the problem with epidemiology, it's not exact prediction. These are ranges of certainty, like making a bet. And I sometimes tell people that public health is a combination of risk plus human behavior, which is not exactly easy to predict at all times. So they ran 2,000 simulations, and even at current levels, most of the simulations show us becoming endemic within the next 20 years. However, if we continue to drop, which some people are worried we're going to have a continued drop in measles vaccination rates, that time to endemicity just keeps going down and down. The other concern is that for some of these other diseases like rubella, if we keep dropping further, say 30, 40, 50% drops in vaccination rates, even rubella, polio, and diphtheria could become endemic again, which we really don't want to have happen. So the problem with this is not only do we have a lot of cases, but hospitalizations and deaths and the costs. So I've actually run some numbers on that. There are some estimates for the cost of a measles outbreak. So, for example, there are 3 buckets of costs. One is the public health costs. So you have to do a lot of contact tracing, testing, things like that. You have lost productivity. One of the problems with measles is because of the long incubation phase. When someone's exposed and not vaccinated, they need to quarantine for a full 3 weeks. That means that kid has to be home from school, and one of their parents has to be home with them missing work. And so there's a big chunk of lost productivity. Or if the kid gets sick and in the hospital, of course, mom or dad's going to be helping with that as well. And then there's direct medical costs, office visits, hospitalizations, some of the long-term neurologic complications, which are decades of expenses. And I've put a link to the article if you want to read this breakdown of costs below. So, for example, in North Dakota, which now has an outbreak, for example, they've got listed on their website all the potential exposure locations for the measles cases they've had up there, and then how long people need to stay out for that 3 weeks. So, if you're exposed in any of these, if you were in these locations and your kid's unvaccinated, they should be quarantining for this length of time, and that's where some of the lost productivity comes in. So what I've done is I've taken some of those assumptions. So within that article, they model the number of cases in the next 25 years based on current vaccination rates. If we have a 10% drop in vaccination, another 10% drop in vaccinations, or a 5% increase in vaccinations. So if we take this problem seriously, get under control, what would happen? And you see a huge difference in numbers of cases. Right now, roughly 20% of kids are estimated to be hospitalized when they're infected, especially younger kids. And then deaths right now, the best guess is about 0.3% end up in dying from their measles. Not a huge number, but still a lot. But when you start having this number of cases, you start hitting thousands of pediatric deaths. And then a cost, because if it's a $47,000 estimate per cost for all of those things added together, you multiply it out, this gets very expensive and in the billions. Now, this is a 25-year cost, so annual costs if you were to start budgeting for this, and if we're going to let measles vaccines stay where they are or keep dropping, we're going to have to start thinking we're going to have to start budgeting, say, $1.6 billion to $21 billion a year for costs. So just the Texas outbreak so far, 1,024 cases with 128 hospitalizations, that's probably about $48 million in costs already that have been racked up because of that Texas outbreak, and we're just getting started potentially. Hopefully there's been enough of a response and an increase in vaccinations in those areas that will stop this. So there is a chance we might start increasing our measles vaccination rates and avoid all these costs, hospitalizations, and deaths. So one of the problems, of course, is the measles misconceptions and misinformation out there. It's been generations since most people have seen any measles or have any experience with it, so most people have forgotten how bad measles used to be. So there's a fiction out there that measles is just a mild disease. We have a little party, kids get infected, they get sick for a few days, now if they go again. And that's not true. That is true for some children, but there are quite a few children who are hospitals. And so that somewhere in the range of 10 to 20% of children are hospitalized. The rates are higher for younger children. So some people back in the day with chickenpox would have a chickenpox party. That actually made sense before chickenpox vaccine, because you were better off getting chickenpox when you're a child than when you were older. You're more likely to be hospitalized when you're older with chickenpox. The inverse is true as measles. You would not want to get measles in the first year of life. And of course, the problem is 1 to 3 of those children will die, and one out of 1,000 will also get encephalitis. That can lead to deafness and other issues. The other problem with measles specifically is the immune amnesia effect that happens. So after people get measles, their immune system is partially reset, and they lose a lot of their antibodies to other infections as well. So a couple things I've pointed out here. Just so far, those hospitalizations from the Texas outbreak listed in the CDC website, 128 hospitalizations. You'll look at the hospitalization rate, and you'll see that 23% of the kids under age 5 aren't landing in the hospital. Not quite as bad, but still 8 and 9% hospitalized when you're older, but 23% when you're under 5. And so if it becomes endemic, most kids will start getting it when they're under 5. And so very high hospitalization potentially in the future. I've also linked to some articles about the measles leaving your immune system vulnerable to other diseases. And so this article, the one here, actually looks at a range of antibody drop, for example, that happens after measles. And so one of the things that when you immunize a population against measles, the mortality doesn't just stop from measles, it stops from many other diseases as well. And the other problem is we're starting the drop in measles isn't just a problem for measles. The drop in vaccinations are overall. We're having a drop. We've had a drop in parents immunizing their children against influenza. And this year we had the highest number of pediatric flu deaths in the last 15 years. About 15 years ago, 2009-10, we had a worse influenza strain. But since then, the last 15 years, this is the worst number. And I think if I remember correctly, I just saw that another 10 were added since this article was written. So I think we're at 226 pediatric flu deaths last year. Well, these will also go up if kids have been infected with measles previously, because that makes them immunocompromised for a while. So should you worry? Well, I'd say not if you're healthy and vaccinated. So I'm not worried because I actually just had my booster, which I'll get into in just a minute. My children have all been vaccinated, so I don't think we have much to worry about. If you're healthy and vaccinated, you've had 2 shots, it's at least 90% effective, and even when it's not effective, the infection is usually mild. However, the people who should be worried are those who are immunocompromised and immunized infants who are too young to get vaccinated. This becomes a problem with them. The last pediatric death we had about 10, 15 years ago was a kid who was vaccinated but being treated for cancer and was exposed by someone who'd been traveling overseas, came back with measles and infected that child, and then they died not because they weren't vaccinated, but because they were on medications for their cancer, and so that put them at risk. So if you had an immunocompromised child, I'd be nervous about sending them to a school that had a less than 95% vaccination rate, for example. The other issue is travel. So if I had an 8-month-old baby, I would be very careful about where I travel right now. So, for example, I would not go to these areas of Texas if I had an 8-month-old child who was not vaccinated. And that's part of the problem. There's a window between 6 to 12 months where children are typically not vaccinated, and they would be at risk. So now we're going to have to be careful traveling with infants again if this is where we're going to be headed. Now, a child below 12 months of old can get vaccinated with measles, but it can be a problem because if they're less than 9 months, it's not as effective long term. So you have to make a little bit of a judgment call. That's a discussion with your pediatrician or family doctor. If you do have a child in that 6 to 12 month range and you're going to be traveling, you may want to ask them about that as a possibility. So another problem, of course, is adults need to get a booster, and the answer is yes. It turns out my wife and I both meet the criteria for that because of the age of when we were born. I actually knew for a fact I did not have the second dose when I was in college. When I was in college at Creighton, there was a measles outbreak, and I did not get the booster, so I went ahead a few weeks ago and I did get the booster. My wife, because of age range, and also people who travel a lot internationally or in healthcare, may want to make sure if you're not sure that you're immune, you may want to get a booster yourself. And so I have several colleagues who've actually gotten their own measles booster lately. So hopefully this is helpful to you, and as usual, I've got links to all the articles discussed below. So these are posted in the notes section, so if you want to look at the CDC measles outbreak page or look at Texas or Kansas or reading these articles, these are here so you can look at the stuff yourself and hopefully get more educated on this.